It's critical that everything that we do from a prevention standpoint is informed by the data. Generally, we're waiting 2 years before we get national data on suicides. That's just unacceptable, and I think COVID has really exacerbated that problem. So this priority is about getting real data so that we can actually have data-informed solutions to drive our response to suicides in the United States. That's really what real-time and better quality data surveillance is all about, is just getting there early so that we can intervene earlier. Talking about increasing our suicide surveillance infrastructure for a long time. I think that what happened with COVID is that we understood that the conditions were such that we could forecast potentially an increase in suicide rates. We really needed to validate whether that was actually happening, whether there were actually increases in suicides. And that data was just very sparse. So we couldn't make really that well-informed decisions on policies. And so enhancing our data infrastructure became more crucial now than ever to really drive solutions. There are certain groups for which we have really low quality data if we have data at all. One of the foremost groups is lesbian, gay, bisexual, transgender, queer, intersex, and asexual, LGBTQIA. Plus, we don't have great data on suicide rates among that group. So when we're talking about better quality data, we're also talking about identifying suicide rates for groups that we think might be at high risk, but that we don't yet have data, solid data, to actually measure those trends and that burden. Having real-time data is critical for making informed policy decisions, but I think we still need to convince voters, convince our population in general, and convince our governments at all levels that data doesn't just happen, that there's an infrastructure in place that needs to support it. We think that our public health surveillance systems across states are woefully underfunded to meet the need that currently exists for conducting real-time surveillance and better quality surveillance. For data and surveillance, it's an all hands on deck kind of effort. And we really need collaboration. The only way for this to be successful is collaboration at all levels. But I think also that the private sector can play a role in identifying optimal solutions and perhaps helping out and providing those solutions to our local public health surveillance systems. We have a real-time data surveillance system in the US. We can spot trends and we can spot deviations from the norm so that we can identify very early whether there are populations for whom suicide risk is increasing, or so that we can identify regions where suicides might be clustering. And then we can intervene. We can actually direct resources to those populations or to those regions and actually try to mitigate the increase so that we can curb its spread, essentially, if you will. Suicide is the 10th leading cause in the United States. And if we can have data to better inform the mental health, the burden that mental health and suicide places in the United States, we're going to be well positioned to mitigate this and to reverse the increasing trends that we're seeing today. If we don't capitalize on this moment, if we don't really push and get better quality and more timely data, I don't know when we will.